Ultimate Mental Health Conversion Disorder Practice Guide. Question 1. A 33-year-old female diagnosed with bipolar I disorder has been functioning well on lithium for 11 months. At her most recent checkup, the psychiatric nurse practitioner states, "You are ready to enter the maintenance therapy stage, so at this time I am going to adjust your dosage by prescribing." Option A. A higher dosage. Option B. Once weekly dosing. Option C. A lower dosage. Option D. A different drug. The correct answer is option C. A lower dosage. Bipolar I disorder is a chronic condition requiring long-term management, and lithium remains a first-line mood stabilizer for both acute episodes and maintenance therapy. The key principle in maintenance therapy is. Question 2. Which intervention is most appropriate for a patient with a phobia of flying? Option A. Exposure therapy. Option B. Cognitive restructuring. Option C. Medication management. Option D. Psychoeducation. The correct answer is option A. Exposure therapy. Exposure therapy is considered the most appropriate intervention for a patient with a phobia of flying. This therapeutic approach involves gradually exposing the individual to the feared stimulus, in this case. Question 3. You have been working closely with a patient for the past month. Today he tells you he is looking forward to meeting with his new psychiatrist but frowns and avoids eye contact while reporting this to you. Which of the following responses would most likely be therapeutic? Option A. A new psychiatrist is a chance to start fresh, I'm sure it will go well for you. Option B. You say you look forward to the meeting, but you appear anxious or unhappy. Option C. I noticed that you frowned and avoided eye contact just now. Don't you feel well? Option D. I get the impression you don't really want to see your psychiatrist, can you tell me why? The correct answer is option B. You say you look forward to the meeting, but you appear anxious or unhappy. Choice B is the most therapeutic response as it acknowledges the discrepancy between the patient's verbal statement and nonverbal cues, by addressing both the patient's expressed anticipation and the conflicting. Question 4. What should the nurse include in patient education for a patient starting on bupropion for major depressive disorder? Option A. Avoid consuming alcohol while taking this medication. Option B. Take the medication in the morning to prevent insomnia. Option C. It may cause significant weight gain. Option D. It is used as a first-line treatment for anxiety. The correct answer is option A. Avoid consuming alcohol while taking this medication. Patients prescribed bupropion should be educated to avoid consuming alcohol while on this medication to reduce the risk of seizures. Bupropion lowers the seizure threshold, and alcohol can further increase this risk. Question 5. During cognitive behavioral therapy, a 12-year-old patient reports to the nurse practitioner. Option A. I was so mad I wanted to hit my mother. Option B. I thought that everyone at school hated me. That's not true. Most people like me and I have a friend named Todd. Option C. I forgot that you told me to breathe when I become angry. Option D. I scream as loud as I can when the train goes by the house. The correct answer is option B. I thought that everyone at school hated me. That's not true. Most people like me and I have a friend named Todd. In cognitive behavioral therapy, recognizing and challenging negative thoughts is crucial for progress. Choice B demonstrates the patient's ability to identify and correct distorted thoughts, indicating positive. Question 6. In a patient with bipolar disorder, which symptom would indicate a manic episode? Option A. Excessive sleeping. Option B. Low self-esteem. Option C. Decreased need for sleep. Option D. Anhedonia. The correct answer is option C. Decreased need for sleep. The correct answer is C. Decreased need for sleep. A decreased need for sleep is a hallmark symptom of a manic episode in bipolar disorder. During manic episodes, individuals may experience significantly reduced. Question 7. What assessment question will provide information to the healthcare provider regarding the effects of a woman's circadian rhythms on her quality of life? Option A. How much sleep do you usually get each night? Option B. Does your heart ever seem to skip a beat? Option C. When was the last time you had a fever? Option D. Do you have problems urinating? The correct answer is option A. How much sleep do you usually get each night? The correct assessment question to understand the effects of a woman's circadian rhythms on her quality of life is to inquire about her sleep duration. Circadian rhythms significantly influence sleep patterns, so. Question 8. A healthcare provider is providing care for a patient with schizophrenia. Which symptom would be considered a positive symptom of this disorder? Option A. Eulogia. Option B. Anhedonia. Option C. Delusions. Option D. Flat affect. The correct answer is option C. Delusions. Delusions are considered a positive symptom of schizophrenia. Positive symptoms represent an excess or distortion of normal functions, such as hallucinations, delusions, or disorganized speech or behavior. N. Question 9. A patient with schizophrenia is prescribed clozapine. Which potential side effect requires regular monitoring? Option A, weight loss. Option B, hypertension. Option C, agranulocytosis. Option D, hyperthyroidism. The correct answer is option C, agranulocytosis. When a patient with schizophrenia is prescribed clozapine, regular monitoring for agranulocytosis is essential. Agranulocytosis is a severe reduction in white blood cells that can be life-threatening. Monitoring. Question 10. Which characteristic presents the greatest risk for injury to others in a patient diagnosed with schizophrenia? Option A, depersonalization. Option B, pressured speech. Option C, negative symptoms. Option D, paranoia. The correct answer is option D, paranoia. Paranoia in patients with schizophrenia can lead to aggressive behaviors, including violence, which poses a significant risk of injury to others. Individuals experiencing paranoia may perceive others as threats and. Question 11. In assessing a patient for signs of serotonin syndrome, which of the following symptoms would be consistent with this condition? Option A, hypotension, bradycardia, hypothermia. Option B, hypertension, tachycardia, hyperthermia. Option C, hypotension, tachycardia, hypothermia. Option D, hypertension, bradycardia, hyperthermia. The correct answer is option B, hypertension, tachycardia, hyperthermia. Serotonin syndrome is characterized by a triad of symptoms: hypertension, tachycardia, and hyperthermia. Therefore, the correct answer is B, hypotension, bradycardia, and hypothermia. Choice A are not typical. Question 12. During pregnancy, a woman is in a relationship with a male who routinely abuses her. Her unborn child may engage in high-risk behavior as a teen as a result of Option A, maternal stress. Option B, parental nurturing. Option C, appropriate stress responses in the brain. Option D, memories of the abuse. The correct answer is option A, maternal stress. Maternal stress during pregnancy can have long-term effects on the child's behavior and stress responses. Research shows that exposure to high levels of stress hormones in the womb can influence the developing fetal. Question 13. A patient with generalized anxiety disorder, GAD, is prescribed buspirone. The nurse understands that buspirone is different from benzodiazepines because it, Option A, has a high potential for abuse. Option B, works immediately to relieve anxiety. Option C, does not cause sedation. Option D, is used for short-term treatment only. The correct answer is option C, does not cause sedation. Buspirone is different from benzodiazepines because it does not cause sedation. Unlike benzodiazepines, buspirone has a lower potential for abuse and does not cause the sedative effects commonly seen with. Question 14. A patient being treated for insomnia is prescribed Ramelteon, Rosarum. Which comorbid mental health condition would make this medication the hypnotic of choice for this particular patient? Option A, obsessive-compulsive disorder. Option B, generalized anxiety disorder. Option C, persistent depressive disorder. Option D, substance use disorder. The correct answer is option D, substance use disorder. The correct answer is D, substance use disorder. Ramelteon is preferred for patients with substance use disorder because it lacks abuse potential. This makes it a safer choice for individuals with a history of. Question 15. Tomasz is a 21-year-old male with a recent diagnosis of schizophrenia. Tomasz's nurse recognizes that self-medicating with excessive alcohol is common in this disease and can co-occur along with Option A, generally good health despite the mental illness. Option B, an aversion to drinking fluids. Option C, anxiety and depression. Option D, the ability to express his needs. The correct answer is option C, anxiety and depression. Individuals with schizophrenia often turn to excessive alcohol consumption as a way to manage symptoms of anxiety and depression. This maladaptive coping mechanism can exacerbate the challenges associated with. Question 16. Which of the following medications is commonly used to treat attention deficit/hyperactivity disorder, ADHD? Option A, haloperidol. Option B, fluoxetine. Option C, methylphenidate. Option D, clozapine. The correct answer is option C, methylphenidate. Methylphenidate is a central nervous system stimulant commonly used in the treatment of ADHD. It helps improve focus, attention, and impulse control in individuals with ADHD. Haloperidol and clozapine are. Question 17. Which approach involves surgically implanting electrodes into specific areas of the brain to stimulate regions identified as underactive in depression? Option A. Transcranial magnetic stimulation. Option B. Deep brain stimulation. Option C. Vagus nerve stimulation. Option D. Electroconvulsive therapy. The correct answer is option B. Deep brain stimulation. Deep brain stimulation is a treatment approach that involves the surgical implantation of electrodes into specific areas of the brain to stimulate regions identified as underactive in depression. This method aims to. Question 18. A client is diagnosed with somatic symptom disorder. Which question will help the nurse develop nursing diagnoses for this client's plan of care? Option A. Are you satisfied with your appearance? Option B. Do you take medication for anxiety as prescribed? Option C. When did you last feel detached from your environment? Option D. How long have you had these memory problems? The correct answer is option B. Do you take medication for anxiety as prescribed? In clients with somatic symptom disorder, it is crucial to assess their adherence to medication for anxiety as prescribed. This question helps the nurse understand the client's treatment compliance, which can impact. Question 19. Which characteristic in an adolescent female is sometimes associated with the prodromal phase of schizophrenia? Option A. Constantly afraid another student will steal her belongings. Option B. An unusual interest in numbers and specific topics. Option C. Demonstrates no interest in athletics or organized sports. Option D. Appears more comfortable among males. The correct answer is option B. An unusual interest in numbers and specific topics. During the prodromal phase of schizophrenia, individuals may exhibit subtle changes in behavior or interests. An unusual interest in numbers and specific topics may be a sign of cognitive disturbances that can. Question 20. Gilbert, age 19, is described by his parents as a moody child with an onset of odd behavior at age 14, which caused Gilbert to suffer academically and socially. Gilbert has lost the ability to complete household chores, is reluctant to leave the house, and is obsessed with the locks on the windows and doors. Due to Gilbert's early and slow onset of what is now recognized as schizophrenia, his prognosis is considered. Option A. Favorable with medication. Option B. In the relapse stage. Option C. Improvable with psychosocial interventions. Option D. To have a less positive outcome. The correct answer is option D. To have a less positive outcome. The scenario describes Gilbert as having an early and slow onset of schizophrenia, which typically indicates a less positive prognosis. Individuals with such presentations may experience more severe symptoms and. Question 21. Which of the following is a common side effect of benzodiazepines prescribed for anxiety? Option A. Insomnia. Option B. Weight gain. Option C. Drowsiness. Option D. Increased appetite. The correct answer is option C. Drowsiness. Drowsiness is a common side effect of benzodiazepines prescribed for anxiety. Benzodiazepines work by depressing the central nervous system, which can lead to drowsiness as a side effect. This sedative effect is. Question 22. Which intervention is particularly well chosen for addressing a population at high risk for developing schizophrenia? Option A. Screening a group of males aged 15 to 25 for early symptoms. Option B. Forming a support group for females aged 25 to 35 with substance use issues. Option C. Providing coping skills information to a group aged 45 to 55. Option D. Educating parents of developmentally delayed 5 to 6-year-olds on early intervention importance. The correct answer is option A. Screening a group of males aged 15 to 25 for early symptoms. Screening males aged 15 to 25 for early symptoms of schizophrenia is a well-chosen intervention as this age group is at a higher risk for developing the condition. Early identification can lead to timely treatment. Question 23. When using therapeutic communication with a withdrawn patient who has major depression, an effective method of managing the silence is to. Option A. Engage in a quiet meditation. Option B. Ask simple questions even if the patient will not answer. Option C. Use the technique of making observations. Option D. Simply sit quietly and leave when the patient falls asleep. The correct answer is option C. Use the technique of making observations. Using the technique of making observations is an effective method of managing silence when communicating with a withdrawn patient who has major depression. This approach can encourage the patient to engage and feel. Question 24. A patient with schizophrenia is experiencing auditory hallucinations. Which nursing intervention is most appropriate? Option A. Encourage the patient to ignore the voices. Option B, provide a structured and safe environment. Option C, engage the patient in a debate about the reality of the voices. Option D, ask the patient to describe the content of the hallucinations. The correct answer is option D, ask the patient to describe the content of the hallucinations. The most appropriate nursing intervention when a patient with schizophrenia is experiencing auditory hallucinations is to ask the patient to describe the content of the hallucinations. This intervention helps assess. Question 25. Which of the following therapies is considered the most effective for treating phobias? Option A, cognitive behavioral therapy. Option B, psychoanalysis. Option C, medication management. Option D, group therapy. The correct answer is option A, cognitive behavioral therapy. Cognitive behavioral therapy (CBT) is widely recognized as the most effective treatment for phobias. CBT helps individuals identify and change negative thought patterns and behaviors associated with their phobias.